I've been at Westchester Medical Center for 3.5 years, and every day I'm in awe of what this hospital does. Family First is just one more example of something that we're doing to make sure our patients and families have the best possible experience.
One of our greatest responsibilities as physicians is to maintain communication, not only with other caregivers, but primarily with the patients and their families. And that's a big challenge when a patient goes to the operating room, because now there's a physical barrier that patients and their families cannot cross that line. We are desperate for innovative approaches to break that barrier.
So a key component of the WMC Health mission is that we provide high-quality, patient-centered care. We think primarily of our patients, but with our patients come their families.
If families are not communicated to during the course of care, families can be waiting for hours without word. They're wondering, I haven't heard anything, it's 10 o'clock, now it's 10:30, now it's 11 o'clock, what's happening? What is happening with my family member? It's vital to keep the family informed.
You cannot take care of a patient without taking care of their support system, which is their family. The only way you can care for the family is to keep them informed. And Family First actually meets that goal.
Prior to Family First, the communication was inconsistent. They weren't always sure how to communicate with the families. Are they waiting in the waiting room? Are they in the cafeteria? Have they left the building? Now they have a singular communication vehicle to be able to reach out to the families no matter where they are.
93% of the family members who use the tool find that the communication increases with the provider. And 90% of the families that use the tool tell us that it has decreased their anxiety.
Since we've implemented Family First, our patient satisfaction scores have gone up 20 to 30 percentile points.
The Family First tool offers a level of freedom that allows loved ones and caregivers to step away from the waiting room. Maybe that's just to go grab a cup of coffee or something to eat. Maybe it's to take a walk. Or maybe a family member has other responsibilities that they have to attend to. So it frees the family up from having to sit and wait for an extended amount of time.
One of the things we don't have a lot in this day is time. Family First goes a long way of allowing us to communicate without worrying about losing time. A Family First message takes maybe a second, maybe 2 seconds, but it certainly doesn't take any more time than just a few thoughts put onto a cell phone.
If the family receives a message that, for example, your loved one had a good night, it eliminates those additional phone calls. And in the course of a busy day of a nurse, it really adds to spending that time with the patient.
It's easy to use for our patients and their loved ones. It's HIPAA compliant, and it helps to ensure that communication is delivered to our families when they need it, wherever they are. We think about how that would decrease the anxiety level of a family who just want to know, how's it going in there?
Actually, a family member just told me a little while ago how much she loved Family First because while her husband was in the operating room, she was receiving updates on how the procedure was going and that he was safe and being cared for. And it just decreased her anxiety level significantly. And we're just looking forward to him coming out of the OR.